Assalamualaikum and good morning to my fellow friends and Dr. Vijay. My name is Vanina Unia Asra, representing my group to present about t-test. And this is our table of content. Hi, I would like to start with the introduction of the t-test. T-test is a statistical method used to determine whether there is a significant difference between the means of the group. It helps researchers decide if an observed difference is likely real or happened by a chance.
Hi, I'm Shasha Ajira binti Arazimi. So today I will present about types of t-test. We have three types. Firstly, we have pair t-test. This test is used when we measure the same group twice, like before and after. As example, we measure the blood pressure before and after they take the medicine. Next, for the next one is the independent t-test. It is to comparing between two groups. So, as example, compare average test score of the female vs the male in the class. Then, two groups are separated and unrelated. And lastly, we have one sample t-test. This is to compare the mean of the single group to a known value or population mix. So that's all. Pass to the next person.
Assalamualaikum. My name is Azra Tabarna and I will continue for the assumptions before using the t-test. So firstly, data should be normally distributed, which both groups being compared should follow a normal distribution. For example, when you are comparing test scores for two classrooms. So the assumption is that the scores must follow a bell-shaped curve. If one class has scores highly skewed, then the t-test may not be reliable. And then the second is data should be continuous. The variables must be on interval or ratio scale. For example, measuring height in centimeters and weight in kilograms is both continuous data. The third is groups should have equal variances. In independent tests, the assumption of homogeneity of variances, equal variances, ensures that the comparison is valid. For example, if we are comparing the heights between two age groups, so when the heights across both groups is equal, it is equal variances. If unequal variances defines that the comparing both of the classroom, the height is not similar. So this requires using words t-test instead of the standard independent t-test. So why testing normality is important? Validity of the t-test. So t-test results rely on the assumption of normal distribution to accurately calculate probabilities and p-values. Suppose you conduct a study on reaction times of two groups, trained and untrained individuals. If reaction times are heavily skewed in one group, so the t-test may underestimate or overestimate the significance, leading to inaccurate conclusion. So the solution is if the data is not normally distributed, alternative non-parametric tests like the Mann-Whitney U test and Wilcoxon sign rank test should be considered. So there are two normality tests in SPSS that we commonly use. So the first one is Shapiro-Wilk test. It is highly effective for small sample sizes like lower than 50 participants. If the value is more than 0.05, the data is considered normally distributed. Second one is called Kolmogorov-Smirnov test. It can be used for a larger sample size or more than 50 participants. Again, the p-value, if the p-value is more than 0.05, it indicates a normal distribution. Thank you.
Hello, my name is Ainul and I will explain on how to perform t-test in SPSS software. So this is the first one. I will introduce the independent sample for t-test. So this is my example data. So to continue for this data, you have to format the table on the data variable view by putting the groups and score as label. So in this video, I will show you how to do it. So first thing first, you need to label one is group, and then the second one is the score. So in the group, your setting will be changing on the decimal. Decimal is 0 for each one, and then the values in the group will be group value 1 for group A, value 2 for group B. Um, and then um, for the missing is none, columns is 0, alignment is right, and then the measure will be nominal. For the score is type of numeric. Width will be 8, same as the group scores. But this one is non-values, and then the measure will be scale. Okay. After you did the format, you can insert your data to the data view. Group A is level as 1 is, and then group B is level as 2. So total of the score will be 20 total. And then you have to select the analyze option and then compare the means and the proportion. Then choose independent sample t-test. Okay, and then after that you will get the finalized analyzed data. After you did the format, you can insert your data to the data view. Group A is level as 1 is, and then group B is level as 2. So total of the score will be 20 total. And then you have to select the analyze option and then compare the means and the proportion. Then choose independent sample t-test. Okay, and then after that you will get the finalized analyzed data. After you did the format, you can insert your data to the data view. Group A is level as 1 is, and then group B is level as 2. So total of the score will be 20 total. And then you have to select the analyze option and then compare the means and the proportion. Then choose independent sample t-test. Okay, and then after that you will get the finalized analyzed data. Okay, for the data paired sample t-test, the first thing first, I will show you my example. Okay, before and after results. So paired t-test must have two results, just before and after. To format the data to the variable by putting before and after data. So you have to label before and after. Uh, Name is before and after. Type will be numeric. Width will be 8. The decimal will be 0. Label will be before and after. Variables will be none. Um, Missing will be none. Columns will be 8. Align with right. And measure both of them is scale. Okay, then you have to put the same thing as before. Insert the data to the data view. Before and after score data is detailed. Total 10 data is inserted. Okay, according to how many your data is. So as for the example will be 10 data. Then select the analyze option. Then to the compare means and proportion again. But this time choose paired sample t-test and then click on it. Choose your setting and then you will get the finalized analyzed data. Uh, then the same thing, you have to format the data variable, which is put variable view by before and after data, label as that. So here the decimals will be 0. Um, Label as before and after, values is none. And then put both of them scale, measure as scale. Okay. Uh, then the same thing, you have to format the data variable, which is put variable view by before and after data. Okay. Then you can put the data to the data view. Put before and after score data as detailed. And then as per our example, total of 10 data, which is 10 before and after. 10 before, 10 after. Okay. Then select the analyze option to the compare means and proportion, and then choose paired sample t-test. Uh, Finish the settings, and then you will get the final analyze data. Okay. Then you can put the data to the data view. Put before and after score data as detailed. And then as per our example, total of 10 data, which is 10 before and after. 10 before, 10 after. Okay. Then select the analyze option to the compare means and proportion, and then choose paired sample t-test. Uh, Finish the settings, and then you will get the final analyze data. Okay. Then you can put the data to the data view. Put before and after score data as detailed. And then as per our example, total of 10 data, which is 10 before and after. 10 before, 10 after. Okay. Then select the analyze option to the compare means and proportion, and then choose paired sample t-test. Uh, Finish the settings, and then you will get the final.
After learning how to perform the t-test in SPSS output, now we're gonna need to understand and interpret the SPSS output. So for the first two tables here, the first one is paired sample statistic. This table shows basic descriptive statistic for each condition for pre-MAT-CMJ and post-MAT-CMJ, with sample size of each is 38, and we have the difference mean 40.15 and 45.32 right here, and we have the standard deviation differences also, and also we have SEM. The standard deviation and SEM is for the variability and precision for each conditions. The table number 2 below is the paired samples correlation. This table reveals the strength of the relationship between the paired measurement. Right here, the correlation is 0.72, which indicates this is strong positive relationship between pre and post scores. It also puts here significance 0.0000 that confirms that this correlation statistically significant. The table right here,
Besides these
which
three
stated
tables, we can
paired
also
sample
calculate
stats,
the effect
is
size
the
coherence
goal
T
of the
by calculating
SPSS
it
output.
manually.
So right
Coherence
here,
T
we will
formula
interpret
is the
based
mean
on the sample
difference
size n,
divided by
which
standard
is
deviation
38.
of
The
differences.
mean difference
That's
is
8,
5.70
5.70
cm.
divided by
So the participants
2.34
jumped on average
equal to
5.70 cm
2.21.
higher after
What
MET
it
compared
tells
to
you
before.
is
The standard
an effect
deviation is
size of
2.34
2.21
cm.
is considered
There was some
very
variation in how
large,
much each
indicating that
participant
MET
improved,
had a
but
strong
the
impact
average
on jump
increase stayed
performances.
consistent.
We can
We
also
have the
check for
standard error
the
of the mean
normality, even
0.38
though the paired
cm,
t-test
that this
assumes
value shows how
the differences
precise.
are
We
normally
estimated that
distributed,
5.70
and the
cm
central
increase.
limit
The
theorem
smaller it
support
is,
this
the
with
more confident we
N38.
are.
It is
Then we
also
have the
beneficial to
95%
include
confidence
normality
interval.
test
We
results
are
or
95%
visuals by
confident the true
using
average
figures
increase
such
lies
as
between
histogram.
4.40 and 5.94 cm. We have
Besides
the
these three
t-values and
tables, we
degrees
can
of freedom
also
right here.
calculate the
The
effect size
t-value is
cohort T by
13.61,
calculating
with
it
the f
manually.
is
Cohort
37.
T
That tells
formula
us the
is the
difference
mean
is
difference
well beyond random
divided by
chance.
standard
We
deviation
have
of
the most
differences.
important
That's
p-value
it.
significance
5.17 divided by
0.0000.
2.34
Since
equal
p
to
is below
2.21.
0.05,
What it
we
tells
reject the
you
null
is
hypothesis,
an effect
and we
size
can
of
conclude
2.21
that the
is
MET
considered very
significantly
large,
improved the
indicating
CFTA
that
performance.
MET had
So
a
based
strong
on a
impact
PLAC
on jump
t-test with 38
performances. We
UniKL
can
RCMP
also check
athletes,
for the
this
normality,
MET
even though the
intervention
PAC
caused a
t-test
statistically
assumes
significant
the
increase
differences are
in
normally
counter jump
distributed,
movement performance.
and the central
So
limit
we can
theorem
confident
support this
that
with
MET
an
had a
38.
real
It is
and
also
measurable effect
beneficial
in
to
the
include
PLAC
normality test
t-test.
results or visuals.
Assalamualaikum and hello everyone. My name is Nur Sabrina and I will be presenting 3 examples of t-test application in physiotherapy study. Okay, this is the first article. It is using PET t-test. Okay, this study is titled The Effects of Balance Training on Balance and Fall Efficacy in Patients with Osteoporosis. The researchers conducted a balance training program for osteoporosis patients who are at a high risk of falling. They measured balance performance and fall-related fear before and after the program. The PET test was used because the same participants were tested twice, pre and post intervention. The result showed a p-value less than 0.05, which means there was a significant improvement in balance and reduced fall risk. This proves that balance training had a real measurable effect and supports evidence-based physiotherapy. The second one, this article used independent t-tests. This research is titled Comparison of Isometric Strength of the Trunk and Hip Muscle Groups in Female Athletes with and Without Low Back Pain. It involves 2 separate groups, 26 athletes with low back pain and 30 without low back pain. An independent t-test was used to compare the 2 unrelated groups. The result showed no significant difference in muscle strength between the groups. P-value is more than 0.05, but there was a moderate correlation between certain muscles and disability level in the low back pain group. This tells us that strength alone may not explain low back pain, and we need to consider other factors like motor control and flexibility. The third one is an article using one sample t-test. The article is titled Physiotherapists Implicitly Evaluate Bending and Lifting with Round Back as Dangerous. The aim of the study was to see whether musculoskeletal physiotherapists have bias linking round back posture with dangerous. They used the Implicit Association Test, IAT, and a one sample test was done to compare the mean IAT score to 0, which represent no bias. The mean score was significantly greater than 0, with a p-value of 0.003, showing a moderate level of implicit bias. This is important because it shows how personal bias can influence clinical decisions and patient education.
Thank you to all my teammates for the great explanation. Now, to sum up, I would like to focus on why understanding the t-test methods. In research, it's not just about collecting numbers, it's about making some of them. The t-test help us to make a clear decision based on data, whether we are comparing treatment in healthcare, test score in education, or customer satisfaction in business. Knowing how to correctly apply and interpret a t-test can guide real action. But it is also important to be responsible when reporting results. A small p-value might show a significant difference, but we should always consider the bigger picture like sample size, context, and practical importance. In the end, statistics like the t-tests are not just math tools, they are decision-making tools. They turn data into answers and answers into action. So I think that's all from my group. Thank you for your attention.